and I'm discussing our study on the effects of preoperative steroids in the outcome of phacotrabeculectomy. So glaucoma, it is a chronic optic neuropathy characterized by optic nerve head damage, RNFL damage and loss of function. And trabeculectomy, it's a partial guarded filtration surgery and is most often done along with cataract surgery. Often it fails because of the subconjunctival scarring and the risk factors being the use of anti-glaucoma medications, multiple, for a long period of time. So when we use long period of anti-glaucoma medications, it will lead to subconjunctival inflammation leading to scarring. So how we can improve means we have many preoperative, intraoperative and postoperative strategies, of which we have utilized the preoperative strategies of using topical steroids and discontinuing topical anti-glaucoma medications. So how steroids helps in wound healing means it inhibits the macrophages, decreases the capillary permeability, increases the fibrin deposition, decreases the fibrin deposition and collagen release. The aim of our study was to compare the surgical outcomes of phacotrabeculectomy in primary glaucoma patients who are treated preoperatively with topical steroids to those who were not treated. And we did a prospective open-label randomized control study at glaucoma services at Aravind Eye Hospital, Tirunelveli. And recruitment period was for 4 months with a follow-up of 6 months. And all patients were on anti-glaucoma medications for a period of minimum of 3 months. 81 patients were recruited and randomized into Group A and Group B. And in Group A, topical anti-glaucoma medications were stopped and started on tab acetazolamide and fluorometholone eye drops for a period of 2 weeks. And in Group B, we have stopped anti-glaucoma medications and just simply started on tab acetazolamide for a period of 2 weeks. All patients underwent phacotrabeculectomy. And outcomes were monitored with special emphasis on IOP control, AGM required postoperatively and interventions required postoperatively. Coming to results, both groups were comparable and IOP control, post-op IOP control at 6 months was significantly better in Group A, that is the steroid group, and the number of anti-glaucoma medications that were required were almost equal on both groups, but slightly more on Group B, which is not statistically significant. And the number of postoperative interventions required, better IOP control was achieved in Group A with fewer number of interventions as compared to Group B. Coming to discussion, Broadway et al. Have found that stopping anti-glaucoma medication in starting FML have led to decrease in conjunctival inflammation as well as an improved trabeculectomy success. Similarly, we also had a better IOP control in the steroid group in our study. This is again similar to Bruzigam et al., but they did not have a statistically significant difference between the groups. Bruzigam et al. Have found that the number of AGM required postoperatively was almost 0 in the steroid group and 24% in the non-steroid group. But our study had only a marginal difference between these two groups. Lauren et al. Have found that the postoperative interventions had not been very much significantly different between their steroid and non-steroid group. Our study have showed a better IOP control in steroid group with a fewer number of interventions as compared to non-steroid group. So we conclude here that the usage of preoperative steroids improves the success of the phacotrabeculectomy as compared to patients who did not use preoperatively topical steroids. Thank you all.
These were low-dose steroids used, right?
Yes, ma'am. Yes, ma'am. We have used low-dose steroids for a period of 2 weeks.
And you kept a gap of 2 weeks between the surgery?
We started for 2 weeks prior to, we have planned a surgery, and 2 weeks prior to the surgery, we have stopped the topical anti-glaucoma medications. Both the groups are put into acetazolamide.
And lubricants were used?
No, ma'am. The water drops was given to them was stopped except for the steroids was added. Steroids is the only add we have given.
So what was the method of randomization you have used here?
We just randomized, I don't get we have a statistician who have randomized the patients.
But there are so many methods of randomization. That's what I wanted to know.
It's an open level.
What was the IOP in that case? Did you monitor the IOP when you stopped the anti-glaucoma and just put them on tablet acetazolamide?
Yes, ma'am, but all the patients had IOP was around 20 and 22 in each groups. Preoperatively you are asking, right, ma'am? It was around 20 and 22. It was ranging between 20 and 22.
These patients that who you stopped the anti-glaucoma medications were on a single line of AGM or?
No, all were multiple AGMs. At least 2 or 3 drugs were there, and was on a period of more than 3 months. Like at least minimum of 3 months the patient.
No IOP rise in any
No
of these
ma'am, no ma'am.
patients?
Like though we have given we have not given taken patients. Though it was a randomized study, we have not actually recruited patients who had a higher IOP, like who was not getting controlled with like if it is less more than 25 and all, we have not recruited. And secondary glaucomas also we have not recruited.
All the patients whom you have started tablet acetazolamide DID for 2 weeks, they were compliant.
They said they are compliant. We cannot actually, that is actually a limitation of our study. We are not able to monitor how compliant, because it causes a lot of gastritis. That we have given Pantop also along with that, but we cannot, that is actually a drawback of this study. We cannot comment on the complaints of the patient.
One question. Did you miss out any outcome to be measured? Study any outcome that you can measure? Like, okay, yes, I missed this part. I should have measured this outcome.
Like we have not monitored the field evaluation is not done, sir. Basically because all the patients had a cataract actually. So the pre-op cataract would also inhibit the field evaluation. So we cannot compare what was there pre-operatively and post-operatively with that much. Like some patients, we have not graded the cataract in all these patients. So some patients would have lesser cataract grading as compared to other patients who will have a more cataract grading, which will hinder the results of our this thing, field evaluation. So we have not done that. Thank you.